everyone, and welcome back to my YouTube channel. My name is Priya Mistry and I'm the TMJ Doc. Today we're going to talk about TMD, which stands for temporomandibular disorder or dysfunction. That being said, if you're looking for more information on TMJ disorders for yourself or for a loved one, then this is the YouTube channel for you. Make sure to hit that subscribe button as I post new videos every Friday with information for people that are suffering from TMJ disorders. For those of you who don't know who I am, I'm a general dentist with a practice in Portland, Oregon, where we are dedicated to taking care of patients with TMJ disorders. I work here with my mentor, Dr. Arthur L. Parker. If you haven't already, be sure to check out our office website. Also be sure to check out my Instagram account. My handle is the_TMJ_doc. Also check out my Twitter. I'm not as active there, tweet, but the handle there is @PriyaTMJ. I like to post a lot of tips, trivia, tidbits of information about TMJ disorders, and I'm pretty active on social media, so you can reach out to me through there as well. So let's get right into it. Temporomandibular disorder or dysfunction, which I will refer to as TMD throughout the remainder of this video, is all about the muscles that surround and support the jaw. TMD generally does not specifically refer to problems within the joints themselves. Popping, clicking, crackling, snapping noises, episodes of the jaw locking or catching. Those are considered intracapsular or problems within the joint. So TMD is all about the muscles and nerves that surround and support the jaw. Problems within the joint are much easier to recognize, to diagnose, and maybe most importantly to actually see with MRI imaging and CBCT imaging. TMD is trickier because it cannot definitively be diagnosed by imaging. TMD again is all about the neuromuscular system that surrounds and supports the jaw. The muscles of this system can become dysfunctional with chronic clenching, chronic bruxing. The way the teeth fit together can make those muscles dysfunctional. They can also become dysfunctional from prolonged dental appointments, from previous whiplash injuries, and from postural discrepancies, and more. When the muscles become dysfunctional, they enter a chronic pain spasm cycle, and that's when the symptoms begin. Sometimes they come on gradually, and sometimes they hit you like a ton of bricks. These dysfunctional muscles can also become swollen and edematous, and they can put pressure on nearby structures such as the trigeminal nerve, which only exacerbates symptoms and can mimic trigeminal neuralgia. The symptoms of TMD are incredibly vast, they're incredibly varied, and that's why it's difficult to diagnose. For this very reason, TMD is also called the Great Imposter Disease. The symptoms that are most common with TMD are headaches. Headaches are the #1 reason people come into my office, closely followed by ear-related concerns. Dull ear pain, sharp, ice pick stabbing ear pain, stuffy ears, vertigo, hearing loss, and more. Other symptoms are neck pain, jaw pain, shoulder pain, numbness or tingling in the face or even the extremities. My patients present with many of these symptoms, one of these symptoms, a few of these symptoms. You name it, I've seen it all. Something else that makes TMD a beast of another nature is that there's no scanning or imaging system that can clearly identify or distinguish these inflamed muscles. On top of that, the majority of medical and dental schools do not have a standardized curriculum that teaches how to identify and how to treat TMD. Many schools may teach a little bit about what's happening within the joint, the clicking, the popping, the crackling, the snapping, the jaw locking or catching. But TMD, those muscles, that neuromuscular apparatus, that's not really taught about in the majority of schools. Because the symptoms are vast and varied, because scanning and imaging doesn't clearly identify dysfunctional muscles, because many practitioners have not been taught about TMD and therefore have difficulty identifying it and treating it, many of our patients have been on quite a journey before they get to our office. While searching for answers, these patients have been to their primary care doctors. They've been to dentists, orthodontists, oral surgeons, neurologists, chiropractors, physical therapists, and more. I wanted to create this video to shed a light on exactly what TMD is and why it can be so difficult to get some answers. Many of my patients present with problems outside the jaw joints, such as headaches, neck pain, ear pain, etc., as well as problems within the jaw joints: clicking, popping, crackling, snapping, episodes of the jaw locking. The way we treat TMD and problems within the joints at my office is with orthotics, myofascial release, and osteopathic manual jaw manipulation. We don't have a 100% success rate, but we do have a high success rate, and we've brought many people relief from symptoms that can truly be debilitating. If you were wondering what TMD is, I really hope this video has been informative. So that's really it, my friends. If you like what you heard, if you learned something new, be sure to click like below, subscribe to my channel, do all the things. If you have any questions or comments, make sure to ask them in the comment box below. And remember, my friends, you can never have TMI about TMJ. Thank you.